Hey, hello. There we go. Let me just click that OK button and then it's all done. Okay. Well, hello and welcome to On Target. It's lovely to see everyone. My name is Carrie Raytheon, and I am the director of Uconn Arms Center. This is actually the first On Target session to now be co-sponsored with both Uconn and Yale's Firearm Injury Prevention Center. So we're very proud and delighted to welcome our co-sponsor Yale to this webinar. So On Target meets about once a month. We're taking August off, so don't worry, but we'll provide information about our next one, but we are taking August off. But we meet about once a month to provide an opportunity for dissemination and discussion about emerging gun injury prevention work. This seminar is open to all researchers, policymakers, practitioners, and anyone who wants to know more about research in this field. And we do have a really diverse audience today of different viewpoints and different ways of engaging in this work. So I'm very excited about that. If you are someone who would like to present your research, please email us. We'll drop information in the chat in a little bit once everybody gets on, and we can discuss that further. And again, we welcome presentations from any discipline. So our next seminar, just so you know, will be Wednesday, September 20th, and we'll feature Dr. Jesse Bruin at Brown University. And his topic will be community engagement with law enforcement after high-profile acts of police violence. This is focusing some recently published work from the AA. But today, I'm really excited to welcome Dr. Jens Ludwig. Jens is the Edwin A. and Betty L. Bergman Distinguished Service Professor at the University of Chicago. He is the Pritzker Director of the University of Chicago's Crime Lab. He is the co-director of the Education Lab and the co-director of the National Bureau of Economic Research's Working Group on the Economics of Crime. Jens, that's a lot of stuff. In addition to that, he's also a friend and colleague. And I think that it's not a stretch in all of those roles and his research to say that he has fundamentally influenced how many of us think about crime and gun crime in particular. And I know he's going to talk about it, but I am in fact reading his new book currently. And I just want to give a plug that it is very great and accessible to folks, I think, of all of those roles that we mentioned earlier. So let's move on to today. The format of our this presentation of Jens's work: he'll present for roughly 30 to 35 minutes, and then we'll open up the floor for Q&A. Please make sure that you're muted. And if it comes time to ask a question, Jens will call on you. If there's something in the Q&A, I'll help direct that. But otherwise, Jens is going to drive this entire seminar, and I'm going to sit back and listen. So please join me in welcoming Dr. Jens Ludwig. And Jens, it's all yours.
Great. Thanks so much, Carrie, for having me. Thanks everybody for coming. Now, especially after such a kind introduction, I'm going to be mortified when I can't figure out how to screen share. Hold on. And then, okay. Can everybody see my screen okay?
Yes.
Okay, perfect. Great, thanks. So let me just take two minutes before I start to give you a little bit of background on this book. So I moved to the University of Chicago from Georgetown in the fall of 2007. A doctoral student named Amadou Sis was shot and killed 2 weeks after defending his doctoral dissertation. And that led to a lot of conversation at the University of Chicago about how we could be more helpful to the city of Chicago and other cities around the country struggling with the same problem. And the National Academy of Sciences had just come out with a Blue Ribbon Commission report reviewing all the evidence about what we know about how to reduce gun violence in America, and concluded, like, we don't know anything that's actually actionable. And so that led a bunch of us at the University of Chicago to decide, well, that's the sort of problem that a great urban research university should try and solve. Our theory of change was, the government has vast resources and capacity to do things in the world, but doesn't have any evidence to guide what they're doing. Could we be sort of the R&D partner to the crime lab or to the public sector? We've been working with government agencies in Chicago and around the country now, and lots of nonprofits. And the book basically summarizes essentially what we've learned in that collaborative work. So I think a lot of the most important insights, as you'll see, have come from the government partners and the nonprofit partners that we've been working with. And I'm hoping this will lift up some of those lessons and also provide a little bit of a conceptual framework to make a bunch of things that look like they're very different actually help connect some dots. Okay, so with all of that as background, the problem that has us here is a uniquely American one. So if you look at the murder rates per capita for the US and other developed countries, you can see that I made up this slide myself. It's incompetently done. You can't even see that the US is the bar to the left there. Any slide that is correctly done that a professional would do, you know, I had an intern help with, and anything that looks sort of mangled is all me. So you can see the US, the left bar there, has a murder rate that is just off the charts compared to any other rich country in the world. Even in countries like Turkey that you don't think of as being particularly well run, are looking at the United States thinking, what in the world is going on? And when I break out the murder rate into gun versus non-gun murders, you can see that almost all of that American exceptionalism is driven by the elevated rate of gun murders in the United States. So that really is the driver of the problem. This is also a problem that we haven't made much long-term progress on. As many of you probably know, if you're from a public health background, life expectancy has doubled from 1900. Almost all leading causes of death have plummeted in their per capita mortality rates, but the murder rate in the United States today is almost the same as it was in 1950 and 1900. So we haven't been making any long-term progress on this problem. And so what I want to argue, so what I have realized, or I think I've realized in working at the crime lab with our partners for the last 18 years, is I think one of the reasons that we haven't made more progress is because we've framed the problem incorrectly. So this counts as economist humor here. It's not going to get much funnier than this, just to calibrate expectations. But I think we've been framing the problem incorrectly. And what has looked like a persistent, almost unsolvable problem is actually much more solvable than we've thought once we see it in a slightly different way. And that's what I want to try and talk you through. Okay. So how have we been thinking about the problem? Well, we can just, if you go back to this slide for a second, I think there's one obvious way that you would think about this for starters, which is, all you have to do is just look at the first two bars on this graph for the US and the UK. And you can see, I see exactly what's going on. We've got way more gun murders in the UK. They have way stricter gun laws than we do. We have 400 million guns for a country of 330 million people. The UK has far fewer guns. Isn't the answer as simple as just get rid of all the guns? And I mean, I think part of the answer to that is the 400 million guns are durable goods. They're not going anywhere anytime soon. And I'm looking at the news headlines out of Washington, D.C., and I don't think that federal gun policy is going to change anytime soon. But there's another response to this as well, which is, yes, gun regulations and gun prevalence matter a lot. The data, I think, show us that very clearly, but that is only part of the story. And so to help you see how that's only part of the story, I want to just take you on a little stroll down Dorchester Avenue on the south side of Chicago. It runs right through the heart of campus. You keep going southbound to 71st Street, you get to Easy Tree Recycling. Their slogan is, "A tree is a terrible thing to waste." Now, the interesting thing about Easy Tree Recycling is it's located right at 71st and Dorchester, which is the boundary between two Chicago neighborhoods, Greater Grand Crossing to the west and South Shore to the east. And the interesting thing about Greater Grand Crossing and South Shore is that they are served by exactly the same gun laws. They're both Chicago neighborhoods located in the same city, the same county, the same state, the same country. The gun laws are exactly the same east of Dorchester Avenue as west. And yet the per capita rate of shootings in Greater Grand Crossing is fully twice as high as it is in South Shore. Consistently year over year, through the ups and downs, consistently much, much higher rates of gun violence in Greater Grand Crossing. So you can see that the gun laws are the same, but the rate of gun violence is dramatically different. That suggests that there's got to be something else going on beyond gun laws, as important as gun regulations are. So how would you think about that? So one way that I've come to think about this is that gun violence is not just about guns, but it's also about violence. So gun violence is guns plus violence. And so if gun control is the same in Greater Grand Crossing versus South Shore, and yet the rate of gun violence is dramatically different, then it's got to be the case that another really important driver of gun violence, holding gun availability constant, is huge variability across people and places in the willingness of people to use guns to hurt one another. Another way to sort of say this is, in some sense, this is an optimistic conclusion. Like I think lots of people in America look at our frozen gun politics. So setting aside your politics, like we are where we are on the gun front. And my forecast would be that things are not going to change dramatically in the near term. That doesn't necessarily mean that we're resigned to having this level of gun violence, because there's this other dimension here that winds up mattering a lot, which is violent behavior. Now that raises a separate set of questions, which is like, okay, now what drives violent behavior? If you look at survey data, I spent a lot of time looking at survey data of what Americans think for the book. And if you look at survey data, what you can see is that most Americans, when you ask them what causes gun violence, point to one of two explanations. So one set of people will say, I know exactly what drives gun violence in America. It's morally bad people who are not afraid of the criminal justice system. So the only thing that you can do is disincentivize them through the threat of like bigger sticks, bigger criminal justice penalties. And most of the people who don't hold that view hold a different view, which is no, gun violence driven by economic desperation. It's people who are going to do whatever it takes to put food on their tables. And so the only solution is to disincentivize gun violence by improving the alternatives to crime through jobs programs and social programs and things like that, right? So these will be very familiar ideas to everybody on this call, basically like bad people or bad economic conditions. Now, here's what's interesting about that conventional wisdom, right? So because Greater Grand Crossing and South Shore, they're located literally within the same city, same county, same state, they are served by literally exactly the same criminal justice system. And I don't believe that morality is fundamentally different east of Dorchester Avenue versus right across the street on the west side of Dorchester. It turns out, interestingly, that the poverty rate is exactly the same in Greater Grand Crossing and South Shore, and the level of racial segregation is exactly the same. The racial composition of the two neighborhoods is exactly the same. So what I am not saying is that none of these things matter. Let me just be clear. But what I am saying is that there is a lot of variation in gun violence above and beyond what these factors can explain. And, and I think here's sort of the other interest. So conventional wisdom, as we've conceived of it for a long time, cannot explain something as basic as why one neighborhood has twice as many shootings as another. And the other thing that I would just point out is that this is the mental rut that we've been stuck in for at least 100 years. If you go back to the 1930s, these quotes that I gave you before, they come from the Republican and the Democratic presidential candidates in the 1930s. And every 4 years, we basically hear the same argument, like over and over and over again, leading to no progress, right? And so the argument that I want to make is that we would benefit from expanding our thinking and considering other explanations as well. Now, to start thinking about what those alternative explanations or those additional explanations might be, I think it's useful to recognize that even though I'm going to call these two conventional wisdoms, the left and the right, recognizing that in 2025, nobody knows what the hell that means anymore. But let me call these the conventional wisdoms of the left and the right for convenience. They disagree about whether the solution is bigger sticks or bigger carrots, but they implicitly agree on the idea that gun violence is driven by incentives, that before anybody pulls a trigger, they are at least implicitly thinking about the pros and the cons, the benefits and the costs, the consequences of their actions before they make that decision. And I think that is the often left implicit assumption that I want to question in thinking about what's driving gun violence in America. Okay. So I think we need a different way to sort of see the problem if we want to make progress. And so what I want to do is I want to suggest a very different view of the problem. And I think the starting point for that mindset shift is the recognition that the information that we're getting about gun violence, the information that most of us have about what the gun violence problem in America is coming from media accounts and that media representation of the problem is not representative of the actual problem. So here in Chicago, I can tell, so everybody has seen The Wire. That gives you one initial picture of what gun violence is. I can tell you from here in Chicago, whenever the U.S. attorney for Chicago has a federal racketeering prosecution against one of the drug selling gangs in Chicago that's committing all these murders in a war over drug selling turf, that is on the front page of the Chicago Tribune every day for 2 or 3 weeks. No wonder everybody thinks that's the problem, right, that we're trying to solve, motivated by. And similarly, whenever there's a robbery victim who's shot and killed, that also is a front page news story, right? Often because the victims are very unexpected. We had a master's student who was tragically shot and killed a few years ago at the University of Chicago. It was literally a global story. Here's the sort of shooting that does not make the news regularly. So this was like a 3-sentence kind of thing in the Chicago Tribune a few years ago, but super representative of shootings in Chicago in general. It's 2 groups of kids. So June 2nd, 2012, this is a couple miles from my office at the University of Chicago on the South Side. 2 groups of kids are in the middle of the street at 73rd and Coles Avenue arguing about whether a kid in one of the groups stole a bike from a kid in one of the other groups. 2 groups start to separate, so there's no self-defense rationale for what happens next. Kid in one of the groups pulls a handgun out of their waistband, fires into the other group, hits a kid in the chest. They race down Lakeshore Drive to the Northwestern University ER, where the kid's pronounced dead. That is what most shoot. Now, there's a way to look at that and say, oh, isn't that about some, financial incentive? A used bike on the South Side of Chicago will, if you're lucky, get you $50 on Facebook. The shooter, if you commit a shooting it's in the middle of the afternoon on a crowded street, even in Chicago, they caught the shooter. The guy's now spending 60 years downstate in the Illinois Department of Corrections. No rational benefit cost calculation makes you think a $50 bike is worth 60 years in IDOC. Right. So there's something else going on here. And you can see in the data, so, in criminology, they've got a term, instrumental murders are the ones where the violence is a means to some larger end, to drug selling turf, to getting a robbery victim's property. That accounts for only about 1 in 5 murders in the United States. The overwhelming, and this is true in Chicago, this is true for the United States as a whole, the overwhelming majority of murders are arguments that go sideways and end in tragedy because someone's got a gun. Okay, so then that raises a question of what in the world is going on in these arguments? What are people thinking that would lead them to commit the most serious possible crime, and what do we do about it? And so what I want to do is, if we were in person, what I would do is I would talk you through the sort of the new way of seeing the problem that we've developed here through our work with our partners, through a little audience participation exercise. And the way I would do it in person is I would say, I want you to call out the color of the object in the middle of the slide. And I would do a little trial run, and very few people would mumble black in response to this slide. I would chastise you for being such a lame audience. I would tell you this is only going to work if we go really fast. And then I would talk you through this very quickly. And when we get to this slide, most of you would wind up saying blue rather than following my instructions, which is to say orange, because that's the color of the object on the slide. So if you've taken a psychology class at any point in your lives, you'd recognize this as something called the Stroop test, which is one of the most widely used experiments in all of psychology. So what is the Stroop test illustrating? The Stroop test illustrates some of the ideas that are talked about in, if you've never read Danny Kahneman's amazing book, Thinking Fast and Slow, I would encourage you to hang up on the Zoom, or whatever the version of hanging up is on the Zoom. Run to your local bookstore, don't walk, and get a copy of Thinking Fast and Slow. It'll change how you think about the world, about other people, and yourself. And Thinking Fast and Slow summarizes, I think, one of the key breakthroughs in behavioral science over the last 50 or 100 years, which is the recognition that our minds engage in 2 types of thinking, not just one, even though we're only aware of one of them. So we all think of thinking as the little voice in our head. And that's the thing that gives us the capacity to be rational and weigh pros and cons. To the extent to which we ever do that, that is system 2, slow thinking or rational thinking. There are different terms for this. The problem with system 2 thinking is that it is super mentally effortful. My wife is a big Wordle and crossword fan, and I can see she does this for 15 minutes, and then she's got to do something mindless. And so then she like takes a little break, and then she does it a little again. So that you can tell when you're actually really thinking, you're exhausted very quickly. Thinking with system 2 slow thinking is super, super mentally taxing. And so all of our minds have developed to do a whole other, mostly our minds are doing a very different type of thinking below the level of consciousness that we're not aware of at all, which is what Kahneman calls system 1 thinking. Some people call this intuition or instinct or fast thinking. And what system 1 fast thinking basically is, it's a series of unconscious, really fast automatic responses that we develop to be adaptive to situations that we see over and over again, routine situations that we see over and over again in daily life. And nothing in life is free. I'm an economist by training, so that is the first thing that they drilled into my head when I started taking economics classes. And with respect to the design of our own brains, you could not live without these system 1 automatic responses. They're doing a ton of work effortlessly for you all the time. But the trade-off for system 1 handling most of your daily life for you, essentially on autopilot, is some loss in accuracy. System 1 gets it right most of the time, but not always. Sometimes these usually adaptive system 1 responses can be overgeneralized. And that's what the Stroop test illustrates. So what's a routine situation that you see over and over again in daily life? You see text. What is the automatic response that you have developed? You see text, you read the text. You don't have a little voice in your head that says, you see someone wearing a Uconn sweatshirt or a Yale Public Health sweatshirt. You don't think to yourself deliberately, should I read that? You just read it, right? And what the Stroop test is illustrating for you, and that's useful for you in most of your daily life, the Stroop test is showing you sometimes you encounter an out of the ordinary situation where your normally automatic useful response gets you into trouble. So what does that have to do with gun violence? We know that in a lot of under-resourced neighborhoods in the United States, young people learn very quickly that the adults who in other neighborhoods are able to maintain social control, both police and community violence intervention workers and coaches and teachers and social workers and neighbors, are overwhelmed. And kids learned in those sorts of environments that they're on their own. A kid walking to school in many of the high violence neighborhoods on the South Side, someone challenges them for their lunch money. They know that they don't have any adult to turn to. If they say someone just took my lunch money, people are going to say, we've got more serious things to worry about here. Kids very quickly learn that when you're challenged, you're on your own. If you hand over your lunch money today, you've just signaled to everyone else in the neighborhood that you're an easy victim. So you hand over your lunch money today, tomorrow the person comes back for your coat, the day after that, they're coming back for your phone. So kids, their system 1 learns that the adaptive response to getting challenged is to fight back, and the degree of pushing back need not be proportional to the provocation, because it is not backward-looking retribution in response to what you just did. It is forward-looking signaling to everybody else in the neighborhood that I'm not an easy victim, right? So I get challenged, I push back. That system 1 fast thinking response might be adaptive for most of the things that you see in your neighborhood growing up, but can lead to trouble when someone's got a gun, right? So that normally adaptive system 1 response can lead to trouble when it's overgeneralized. And like we can see, so all I've done so far is I've just told you a story. How do I know that there's something to that? So we're a research center at the University of Chicago. We're all about empirical evidence, not just hypothesizing. And so I'll just very quickly talk you through the first exercise in a program that we did for middle school and high school age male students in the Chicago public schools on the South and West Sides many years ago. Youth Guidance developed the program. The program is called Becoming a Man. The very first exercise is called the fist. So Steve Ross and I would be partners, let's say, okay? And we get out of a class to do this exercise. So there are like 12 kids in a room. There's a BAM counselor. They pair us up. Steve and I are a pair. And the BAM counselor would give me a rubber ball, and they'd say to Steve, who's my partner, you've got 30 seconds to get the ball out of Jens's hand. The only rule is that there are no rules, go. Most of the kids in Steve's position basically beat the crap out of me for 30 seconds trying to get the ball. Steve will try and pry my hand open. That won't work. He'll break my finger. He'll put me in a headlock. That won't work. He'll start punching me in the stomach. That won't work. He'll start biting my ear. Then the BAM counselor will call time. Then the BAM counselor will tell us to switch roles. I do the same thing to Steve. Then the BAM counselor has us debrief. And the BAM counselor then will say, Steve, as part of the debrief, Steve, tell me what strategies you tried. Steve will say, I tried to pry his hand open. He's stronger than he looks. I would say that's almost got to be tautologically true. Steve says, then I put him in a headlock. I punched him. I bit his ear, whatever. It didn't work. And then you called time. And then the BAM counselor will say to Steve, why didn't you ask for the ball? Because Youth Guidance has now done BAM with, over the last decade, something like 10,000 kids in Chicago. And what they tell me is like literally not more than a dozen out of those 10,000 kids ask for the ball. Most of the kids in Steve's position will say, oh, if I had asked Jens for the ball, he would have thought I was and then you can imagine what the kids say. And then the kicker to this debrief is the BAM counselor will turn to the partner and say, Jens, what would you have done if Steve had asked you for the ball? And most of the kids in that position say, I would have, just a stupid rubber ball, I would have been happy to give it to him. It's way better than having my pinky broken, and so on and so on. And so what is that illustrating, right? It is very clear. It's an engaging exercise that shows kids, so show not tell, putting kids in a challenge situation, eliciting their don't look weak system 1 response, showing them that that is overgeneralized in this situation, and then giving them feedback that this is not the situation that you assumed. It is helping kids through trial and error learn that there is this other part of their mind at work that they don't realize, and that part of their mind, their fast thinking system 1 self, can sometimes lead you into trouble. And so before you engage in violence in these high stakes situations, make sure this is a situation where it's really necessary. So this is a very skeptical research audience. And so I know you're looking at this thinking, all you've done is just tell me another story, show me some evidence. Fair enough. Let me talk you through the results of the first 2 randomized experiments that we did in Chicago. These are clinical trials like they do in medicine. We randomized a bunch of 7th to 10th grade male students in Chicago. We look at what happens to the kids in the band group compared to the control group, and participation reduces violent crime arrests by 45%. We redid it with another 2,000 kids a few years later. We see 50% reduction in violent crime arrests. Now, to what degree BAM can scale at much, much larger delivery levels, I think remains an open question. But in terms of proof of concept for our theory about what's driving the problem, these results make no sense under conventional wisdom, because BAM is not threatening people with bigger punishments, and it's not ending all of the root causes in Chicago. All it is doing is helping people see you have this system 1. It can lead you astray in high stakes situations. Take another couple seconds and slow down and really think about what you're doing. Engage system 2 before engaging in high stakes behavior. Right. So how does this explain sort of the Greater Grand Crossing South Shore comparison? So one thing that we know from the data, so remember, the key reason that people rely on system 1 is system 2 is mentally taxing. So my friend Sendhil Mullainathan wrote a great book with a Princeton psychologist named Eldar Shafir called Scarcity, where they show that in social situations where people are subject to higher levels of stress, that depletes mental bandwidth and pushes people to rely more on system 1. And we can see in the data that there is a larger mental bandwidth tax for living in Greater Grand Crossing than in South Shore. And we can see that because through things like COVID hit Greater Grand Crossing much harder than it did in South Shore. There are way more people dealing with the grief of losing a family or a friend from COVID, we can see there's way more disorder, graffiti, litter, things like that in Greater Grand Crossing and South Shore that we know depletes mental bandwidth for people as well. So more of a mental bandwidth tax in Greater Grand Crossing leads to people being more reliant on, it degrades decision-making capacity is one way to think about it. The other thing that's true of South Shore and Greater Grand Crossing is South Shore, by the luck of geography, developed right along the greatest part of Chicago, which is Lake Michigan, which has led for there to be more commercial development interspersed with residential in South Shore compared to Greater Grand Crossing, right? And so what that means is that there are more people walking around to go to stores and restaurants and the corner bodega in South Shore than there are in Greater Grand Crossing. So when somebody's System 1 leads to an altercation, there are more adults around to step in and intervene. This is what Jane Jacobs was writing about 60 years ago when she talked about the importance of eyes on the street. I want to zoom back for a second and show you that I'm not cherry picking two neighborhoods here. So this is, one of the most interesting graphs I think we've produced at the Crime Lab. It's a graph that maps neighborhood median household income for the 77 Chicago neighborhoods against shooting rates per capita. You can see that every rich area in Chicago is relatively safe by US standards. All of the high violence areas are poor. No wonder everybody has this intuition that the story is all about poverty. But what you don't see, because these neighborhoods are never in the news, is that there are a ton of very low income neighborhoods that have relatively low shooting rates. Or put differently, there is huge variability in shooting rates across similarly poor areas. That's a way for you to see that, yes, income is relevant here, but there's a huge amount of variation in what's going on with the gun violence problem that is separate from income. And you can see the same thing, interestingly, when you look across countries, right? If poverty were gun violence destiny, India would be one of the most violent places in the world. Instead, it is one of the safest places in the world, as you can see, at least with respect to things like homicide rates. Okay, so poverty is part of the story, but there's a huge part of this, of why people engage in violence that is above and beyond that as well. Okay, so I think this theory, now we're sort of nearly wrapped up, Carrie, so we're right on time. There's no need to, I think I want to say one thing about how this framework sort of ties together a bunch of things that you've seen in different places over time that seem like a laundry list of disconnected things, but I want to argue that this sort of behavioral economics, behavioral science way of thinking about gun violence makes you see that all of this stuff is actually, it's like part of the same thing. So if you're a psychologist, you look at BAM and you would say, oh, I know what that is. That's CBT. It is CBT. I hate the term CBT, cognitive behavioral therapy, because the T implies that the people who would benefit from CBT are different or unusual, or there's something broken with them. I think the only thing that's different about the people who benefit from CBT is that they're human beings in situations that make the consequences of System 1 mistakes particularly pronounced. CBT, and the reason that that is so helpful, is of an ilk of the same reason that police wind up being preventive of crime, putting more police on the street, because police can serve partly in the role of eye upon the street. Why do community violence interrupters help reduce crime? That doesn't make any sense under conventional wisdom. The people who are engaging in violence because they're morally bad or they're suffering from economically bad conditions, they're just going to wait for the community violence interrupter to go around the corner. The behavioral economics perspective, System 1 violence is more fleeting in its motivation than System 2 driven violence. That helps you understand why violence interrupted is violence prevented, not merely violence delayed. Right? Why does collective efficacy matter? This is an idea that sociologists really spend a lot of time thinking about, the willingness of neighbors to step in and intervene. That is part of the same picture. Many of you will be familiar with this randomized experiment from Philadelphia. You clean up vacant lots, you turn them into pocket parks. What does that do? That gets people out of their homes to spend more time in public to serve as interrupters of violence. You see shootings go down by 30% in low-income neighborhoods. And this also connects to what, and environmental design criminologists and urban planners have been talking about for a long time. This also helps us understand why policies don't work. So I've got a recent review in the annual review of criminology that shows that income transfer and jobs programs do not have, they are very helpful in making people's lives better, so we should do it for that reason. They help reduce property crime, but they don't have the effect on violent crime that we had expected, because that is incentivizing system two. It's not dealing with the problem that a lot of this is driven by system one. Okay, so I think, in other words, I think sort of the big picture argument here is a lot of our policy thinking in this area has been driven by the assumption that violence and gun violence is driven entirely by system two. And I want to argue that the reframe that we need is to recognize that a lot of gun violence is actually driven by system one. And the right policy response there is interruption, not just incentives. And that can be external interruption, whether that's police, security guards, community violence interrupters, things that get more eyes on the street, or it can be internal interruption or self-interruption through CBT-like programs like Becoming a Man, but there are lots and lots of other programs now that have evidence behind them. So I think, let me just skip this. I think the final thing that I'll just close with is I think the real light bulb moment for me was I was inside the juvenile detention center on the west side of Chicago, and one of the staff members in there said, 20% of the kids in here are psychopaths. If you let them out, they're going to hurt other people. But the other 80%, I always tell them, if I could give you back just 10 minutes of your lives, none of you would be here. And I think that really nicely encapsulates sort of the mindset shift that I think we need if we're going to really make big progress on this uniquely American problem. Anyway, that is basically the argument of the book, and I think one of the key lessons that we've learned in the last 18 years of work here at the University of Chicago Crime Lab. And with that, I will stop sharing, and I would be delighted to hear people's reactions and questions and have a conversation.
Yeah.
So
again, Jens is going to call on you. Thank you so much for doing that, Jens. It's distilling like a lifetime of work into 30 minutes. Amazing. We have a huge variety of people. We've got prosecutors, we've got survivors, we've got academics, we've got policymakers, we've got lobbyists on the call, CVI interrupter. So please feel free to ask your questions. We can all learn from your questions as well from Jens. So Jens, I'm going to let you drive from here. And again, if I see something in the chat, I'll interrupt. Otherwise, I'm going to mute.
Great. Yeah, just use the raise hand function in Zoom, and I'll call on you. And I'm looking forward to your reactions. Yes, Earl.
How you doing, Jan? Just a quick question. With talking to people, when we're looking to educate people about things, I think some of the people that we're looking to educate really want to understand the brass tacks. So I'm wondering about data that speaks to the exorbitant costs that deaths or harm or injuries by firearm cause, and what that translates to overall cost in the state and cost in each taxpayer.
Yeah, great question. I mean, I think what you've put your finger on is something that we've spent a lot of time trying to think about at the University of Chicago, where there is a subset of the public who cares about the gun violence problem because it's a terrible public health crisis and a humanitarian crisis. But we can also see, just from looking around and looking at the politics of this issue, that there are a lot of people who are not moved by that motivation. So we've been trying to think of other motivations to think about that, how to move that problem. And I think one way to think about measuring the costs of gun violence is what the effect is narrowly to the government budget. So Medicaid costs go up and lost tax dollars go up and whatever. But I think that is really just sort of the tip of the iceberg. I think I can tell you the argument that I make in Chicago that really gets people to sort of lean in and sit up on their seat, which is my University of Chicago colleague, Steve Levitt, wrote a paper many years ago that showed that every murder, so the overwhelming majority of murders in America are committed by guns, as we saw before. Every murder that happens in a city, in any city in America, reduces the city's population by 70 people on net. That's fewer people moving in, more people moving out. And, so obviously there are a lot of things that determine city level population changes over time, but it turns out that gun violence is a really, really, really important driver. And we did a calculation that showed that if Chicago, since the early 90s, had followed New York's murder trend, we would have 600,000 more people living in Chicago. That is, we would be a city of more like 3.3 million people rather than 2.7 million people. So if you look at all the debates that we're having in Chicago right now, the public school system is facing a $700 million budget deficit for next year. Wouldn't you like to have another 600,000 residents tax paying to help address that budget shortfall? The city is facing $1 billion budget deficit next year. Wouldn't you want more taxpayers? You drive around the south and west sides and the neighborhoods are hollowed out, right? It's a huge problem that makes every other sort of social policy challenge in those neighborhoods much more difficult. I've come to think of gun violence as the problem that sits upstream of every other public policy challenge that we're facing in our cities and our states. And solving this, I think, like not solving the gun violence problem is creating a huge headwind for everything else that we're trying to do to help low-income people in America. I think that might be one way to expand the set of people who realize exactly how important this is. So thank you for the question. Marty, if I may call you Marty,
Yeah,
you've got a question.
First of all, thank you so much for this book. I think I've purchased 10 and sent them all over the place. I've always been enamored with behavioral economics, and this was fascinating to me. I was curious, what do you view as potentially across states, the lowest hanging fruit that could have the most significant impact? Where should folks be focused to have significant impact at a reasonable cost?
Yeah, I mean, it's a great question. So, it's a little bit building on it's a little bit building on this the cities are broke point that I made, right? So like gun violence is the #1 problem for Chicago. This is true for so many cities around the country. And the city not only has no extra money to spend on solving the problem, but they're looking for where they're going to be making cuts moving forward, right? As federal pandemic relief ebbs. I think that there are two places that I'm not saying that these are the two most important things to do in a world in which you had lots of money. What I am saying is in a world in which you have no money and you're very pragmatically trying to think about what to do, these would be, if I were like the deputy mayor for public safety in Chicago, these are the two things that I would focus on. So the first is, we did a study with the Juvenile Detention Center. The reason I was in the Juvenile Detention Center many years ago is we did a study of the Juvenile Detention Center when it was taken over by a new administrator after a federal judge had sort of started to run the place after a lawsuit. And he didn't have any money to do any new sort of social programs. And so he realized the kids would go to the public school in the facility in the morning, and in the afternoon, they would just be in the common room watching TV all afternoon in the common room as a guard stood against the wall, watching the kids watch TV. And what this guy did running the facilities, he basically trained the guards to deliver a BAM-like program to the kids in the afternoon. That is not the greatest social program. These are guards, not trained clinicians. So it's not going to be the best social program that you've ever seen, but it's free. The cost was a week of training for the guards and the price of Xeroxing the program booklets, and it reduced recidivism rates by 20%. Why is that so important? In Chicago, I can see 90% of the shooters and 80% of the victims had prior arrest records. We collectively as a society had them in the criminal justice system. We had the chance to do something more developmentally productive that we could have done for free and would have put some of them on a safer trajectory, and we blew it. So like thing #1 would be every detention facility in the country should be doing that, would be the first thing that I would say. And the second thing that I would say is there is an enormous amount of predictable risk in where these arguments happen that lead to shootings. And so let me just give you like a very quick example of why that is. On the south side of Chicago at 57th and State Street, there's a liquor store that's open until midnight. Every other liquor store on the South Side closes at 10, or almost every other liquor store on the South Side closes at 10. So what happens at 10 p.m., you get everybody from all over the South Side of Chicago who's already a little bit liquored up. They want more booze. They all convert. These are people from all sorts of different neighborhoods. They've got beefs over this high school football game from this year ago. And you said this to me at the mall 3 years ago, and I've been pissed at you since, and whatever. And all of a sudden, we're a little bit drunk, or maybe more than a little bit drunk. We converge to this one liquor store from every neighborhood, and we're all standing in line at that one liquor store for this 2-hour period. And guess what? That turns out to be a gun violence hotspot, but just for those 2 hours. No human intelligence analyst in the Chicago Police Department or at any CVI nonprofit is going to be able to see that gun violence hotspot for just a narrow 2-hour window, but a statistical model can. And I think most police departments in the United States are and I would say many nonprofit organizations as well, are underutilizing the capacity of data to concentrate our resources when and where gun violence is most concentrated. And there's a randomized experiment out of LA from a few years ago that showed that really using data well like that can double the amount of crime prevention you get from the money that you're already spending on police and CVI. So I think that would be the second thing that I would do in a world in which I have no additional money. Sorry for the long answer, but
that was great. Thank you so much.
I'd really focus on. Steve. Oh, sorry, you're on mute, Steve.
I really love the talk, and I'm very sympathetic to all of the behavioral issues, but I'm going to sort of be a little perverse and talk a little bit about the incentives, because you had that wonderful picture where we saw the U-shaped curve where we had the poor violent, poor not violent, and the rich not violent. What's missing, of course, is the upper right-hand quadrant, which would be rich violent, right? And when you were giving your talk, it sort of, what I thought about really was this idea that you're right, that people engage in violence oftentimes instinctively in a moment of stress, but they find themselves in those circumstances where violence might be unwisely occurring because of past decisions, right? I love this recent paper by Ashton Aurora that you probably know, where she looks at the effect of raising the age of maturity from 17 to 18. It has no effect on the criminal behavior of 17-year-olds because their circumstances are mostly set. It has a very large effect on the future criminal behavior of 13-year-olds. And I'm wondering about sort of the interaction between this issue of the circumstances that people find themselves in and sort of trying to change the decisions they make that lead them to be in situations where bad outcomes can occur, in parallel, and how that might complement, or whether that's not as effective a strategy as trying to change their behavior in the moment.
Yeah, let me see if I'm tracking the question here, Steve, which is like, I think, just to sort of re-say what I think the implication that comes out from this perspective of the gun violence problem, which is like, one thing that you can do is social programs that help people anticipate what they might do in a difficult situation, and through trial and error, learn a little bit more about how system one fast thinking might lead them astray in those situations and help them. It's sort of like a decision-making intervention to navigate the very difficult circumstances that people on the South and West Sides have to navigate. So that's one sort of strategy. But a complementary strategy is to make neighborhoods more forgiving. And I think that graph that I showed you for like neighborhood income versus the rate of shootings per capita, what I take away from that is that the list of root causes that matter for gun violence is longer than just income and racial segregation. And those additional root causes are things that are easier to change than income and racial segregation. It can start saving lives like tomorrow. Like, we can zone in more commercial into a low income neighborhood much more easily than we can end poverty and end racial segregation in Chicago, which people have been worried about for 100 years, right? And I think by reducing the gun violence rate, that creates a tailwind for all sorts of other community development activities that can help address those root cause problems as well. So thank you. Tim. Sorry, Tim, you're on mute. I'm not sure if you're speaking. You're on mute.
Okay. Can you hear me?
Yes.
Thank you, Dr. Ludwig. Thank you so much for your talk. It's a pleasure to listen to you speak. I have two questions, and my shall I say, aspirations to contribute to this problem in the United States is often one from a public health perspective and one from a policy perspective. And one of the things I often think to myself as a graduate student is how badly policy and science, how the poor interface between policy and science, how scientists, investigators like you, and policymakers, politicians, do not seem to interface very well. So here's my first question, and it might seem rather so my first question is that have you, okay, let me ask the first serious question. What I think is a serious question is, what would be your recommendations for implementing this in policy, right? How can not just private entities, but governments at municipal level, at city level, at state level, incorporate these into productive policies that can actually move the needle on the graphs you showed? Even if it targets neighborhoods like the two neighborhoods you juxtaposed.
Yeah.
The second question is, and because we do have this dichotomy of blue states, red states, and sometimes we have data showing different outcomes in blue states, red states, and based on laws, is I think, and something you emphasize very much is how Chicago has the same gun laws, same, the two neighborhoods you examine have the same racial composition and socioeconomic indicators. And my question is, one of the things I'm concerned about is that blue states, blue cities may be overly focused on gun reduction, which I don't think it's wrong. But the question is Chicago, the city of Chicago, picking the brains of a great intellectual like you, and are blue states and blue cities doing this when investigators who have unique insights into how to curb gun violence are present, like investigators in New Haven, for instance?
Yeah.
Are politicians reaching out to you asking, how can we incorporate this and how can we make policy? Sorry, it's long word.
Yeah, no, it's great. Yeah, I mean, I think the answer has been, I wrote the book to try and be helpful, and I had no idea what I should expect in terms of whether people would be interested, but I've been very pleasantly surprised by the number of deputy mayors for public safety type people who are interested in talking about this, judges, prosecutors, police chiefs. So I've gotten very positive reaction. The only other thing that I would add is I've gotten very positive red and blue reaction, if that makes sense, right? Because I think the other thing that I've come to characterize myself as pathologically pragmatic. And one of the other things that I like about the behavioral economics perspective of gun violence is not just that I think it is factually true. It really does help us understand the problem in a very different and more accurate way now. But it also has the secondary inadvertent benefit of helping us sidestep a bunch of the political fights that we've been stuck in for 100 years. People disagree about what the right prison penalty should be for whatever sort of crime. People disagree about gun control. That's great. People can keep disagreeing whatever, but here we've got another set of policies that are very pragmatic, that sidestep all of that, that can start saving lives tomorrow. And I think people in red states, people in blue states are very interested in that, especially when there are ideas that they can do that don't cost any money. So thank you for the question. And Carrie, I'm looking at the time. Is maybe I'll
Well, I think we can do the one that's in queue, and then we will give our final thanks and wrap up.
Great.
Yes, my question is, Dr. Ludwig, what would make one group adapt more to the what you call the system one way of response, which is fast, automatic, and what would cause another group to adapt more to system two, which is slow and as you explained?
Yeah, I mean, I think it's what I explained in the like part of what I hypothesized in the context of Greater Grand Crossing versus South Shore is that there's just way more stressors in Greater Grand Crossing than there are in South Shore. And because system two deliberate sort of slow thinking is mentally taxing, anything that is more that adds a lot more stress is basically serving as a bandwidth tax that just makes it harder for people to sort of cognitively navigate the difficult situations that they're navigating. But the good news is I think there are things that we know that can help make the neighborhoods more forgiving and help people better navigate these difficult situations. So thank you for the question. And thank you again, Carrie, for having me and for everybody for coming.
Yes, and thank you, of course, to Jens for coming in the summer, no less. We will make this recording available. It will be emailed out to all of you, but it will also be on our website in the event that you would like to share it with someone. If you have additional questions, please reach out to ARMS, and we will, continue conversations around this topic in an interdisciplinary way. So thank you again, Jens.
Okay, thanks so much, everybody.